This is our respiratory therapy lab. Respiratory therapists provide many vital functions for patients in the hospital, in clinics, doctor's offices, and also extended care facilities. Some of the things that a respiratory therapist would do is to teach someone how to do a breathing treatment. So anything from asthma, allergies, and things like that, they might need a breathing treatment. They also have more critical areas in the hospital, such as the intensive care unit. These are where your patients may be on ventilators, and it'll be a respiratory therapist's responsibility to monitor those vent settings to make sure that the patient is breathing to their best ability, even if they have a machine that's helping them do that. They also do things like arterial blood gases, and they might even be employed at a children's hospital working in the NICU, which is for the very premature babies that are having difficulty breathing on their own. If you've ever had a sleep study, it was probably a respiratory therapist that did that for you as well. So there's lots of different opportunities for respiratory therapists. This is our massage therapy lab. Massage therapy is a one-year certificate. It's very good for people that need a very flexible schedule. You could actually open your own business, or you might want to be employed in a salon. They do teach you all of the different types of massage so that you can pick your choice as to what you want to specialize in. One of the great items that we have here at Washington State is what we call the anatomage table. This table is a virtual cadaver, and basically the students can go down layer by layer through the body to see the different structures within the body. And I'll show you just a moment how we do that, just quickly. As you can see, we're going down layer by layer. And if I wanted to have a student tell me where a particular muscle is, all they have to do is touch it and it'll tell you. This particular instrument is one of very few in community colleges, and this complements our human cadaver lab very well. Many prospective students don't realize that we have a human cadaver lab here at Washington State. Our donors come from Wright State University. We always have one male and one female dissected on each side at all times. When a new cadaver comes in, the previous cadaver is returned. When one cadaver is ready to go back to Wright State University, the second cadaver is moved to the other table and dissected on the opposite side. That way, when the new cadaver comes in, we'll have, they will be dissected on the front, and the previous will be on the back. One thing that's neat about this is before we send them back to Wright State University, we are permitted to keep all of the internal organs. So that's very nice, because then we have several different items such as brains and hearts and lungs and things like that that they can work on back in the biology lab. This is one of our 3 nursing laboratories here at Washington State. We have 2 levels of nursing. We have practical nursing, which is a 1-year certificate, and we also have associate degree nursing, which is a 2-year degree, and that allows the students to test to become a registered nurse. We also have an EARN program, which allows students to complete their LPN in 2 semesters and then finish out with the associate degree nursing program. So that's just another option. It's especially good for students who need to work at the time that they're in school. We do have a number of different types of mannequins in the nursing program. These particular mannequins are what we call low fidelity. They will allow you to practice just basic nursing progress and basic nursing tasks. And so I'm going to take you to another lab, and it gets a little bit more advanced. This is the second of our nursing labs. In this nursing lab, we have the low fidelity mannequin and also what we call the mid fidelity mannequin. And this is Juno. She's our newest mannequin or human simulator. We are able to connect her to a computer and make her do certain things. And another thing is that she gives the ability for the students to hear breath sounds and bowel sounds and things like that. So it's a little more realistic than our standard mannequins that we have in the nursing program. And this is our third nursing laboratory here. This is iStan, and iStan is considered to be a high-fidelity human simulator. iStan is able to react to our students depending on what's wrong with him. The nurses can actually make his vitals change up on the monitor screen. They can make him have a heart attack or anything like that. Congestive heart failure, all of those different types of things. And then they can watch the students to see how they react to these different scenarios, which is very nice because over here we don't have a lot of serious trauma, but this is our way of training our graduates so that they're ready for that. This is where our radiologic technology students train. We are in articulation with Marietta Memorial Hospital. The hospital takes care of the certificate part of the program, which is the actual radiology courses. We at Washington State provide the courses that they need to complete an associate degree. And that's very important because in order for them to take their registry exam, they have to have both. So they learn all of their written theory classes here on campus, and then they go to the different hospitals and clinics in the area to do their actual hands-on x-rays. This is a medical laboratory technology lab, and this program is great if you are a person that wants to be in the healthcare field, but you don't want that one-on-one patient contact. Your job as an MLT is to be in the laboratory running all of the tests that have been ordered by the physicians. You will spend a lot of time looking at a microscope, and we're very fortunate at Washington State to have a very high-tech microscope for each student that's in the program, and you can see it right here. This allows you to see through the tablet what the student is seeing actually under the microscope. So that's a very good thing for teaching. You will learn all about the different types of the laboratory, the different departments of the laboratory, and when you get out you can decide if you want to work in a hospital lab or a reference lab, maybe a doctor's office, or you might want to go into the industrial lab, which several of our graduates have done. They aren't analyzing blood, but they're analyzing the product of the company for purity or something like that. So you have a lot of different options with this program as well. This is our biology laboratory. Any biology course that you take at Washington State will be conducted within this room. Those include things like the principles of biology, human anatomy and physiology, general biology 1 and 2, microbiology, and ecology. So you will definitely be in this room for several of your classes as a health major.